Initiative process, Bob, you're checked out on that pretty good. I think you're the guy on this one. Tell me, first of all, what you think about that, and both of you chime in whenever you want to, but we have a situation now where the initiative process is being used almost like a tool that if you don't get it done, the legislature is inactive, regardless of how long they've been inactive on this. We're going to do it ourselves. We're going to do it through the initiative program.
We made the initiative process a lot easier beginning in 1992 through the legislative process, and I think there's been 3 initiatives since then. And the problem with the initiative process in Mississippi, Paul, is this. He who has the most money is the one that's going to win. And just look at the marijuana deal. Nobody had money to go up against the initiative process. A few people did, and I think some people volunteered their services. But in the case of trying to expand Medicaid, it's a very, very bad idea to put that on the ballot. And I publicly will say to the Hospital Association, shame on you for doing this. Whether you do it by proxy and letting somebody else do it or not, it's just wrong. Because they have the money to promote it and pass something that's not good. If you don't like something and you put it in the Constitution, that's not how this country was started. If you keep amending the Constitution, you will have no rule of law at all.
Bob, what are the consequences of this when you start looking at it as far as long term? I mean, if you had 5 or 6 years after it's enacted and in process, and we start paying those additional health care premiums, and all of a sudden we have another, depression, recession, or whatever happens, and our budget is just in melee, we've got to pay that. We don't have a choice. In other words, if it's in the Constitution and if it cost us $1 billion, that's got to be paid.
And I really think we have to think about those things, too. Yeah. But going back to what the commissioner said, let's think about Initiative 65 that just came up in front of the Supreme Court. I mean, here we are. That was passed, amendment to the Constitution, and yet it's been challenged. Whether that's good or bad or not, it can be pulled back. So I think we have to think about, like the commissioner said, is this the best way to go, or is it better to look at other options?
I'm a little perplexed on this because we're taking the appropriation process away from the legislature.
That we are. We're trying to.
If that happens, then they can't appropriate the money.
They can't appropriate the money, and then you have the other issue is that you've got the federal dollars coming in that require a match, and that says the Constitution, if you have a constitutional amendment, you'd have to put the money up. I'm just opposed to a constitutional amendment. I think it's the wrong way to go.
Becky Curry was in yesterday, as you all know, and I asked Becky about this, and she said she's been fighting for this for years. And to a layman, it seems like a good idea. If they are paying 95 cents on a dollar, is that it?
Well, that's what we're told, but that's not. All that glitters is not gold, and that's not the case here.
Whoa, back up here. What do you think it really is?
Well, in Mississippi's case, if you expanded Medicaid, and let me get up front.
Yeah.
I'm okay with expanding Medicaid if it's done within the proper framework and you can do it economically in the state of Mississippi. But when you sit down and look at the smoke and mirrors that came out of the federal government, Mississippi would get $690 million. We'd have to put up the money, and that you true up at the end of the year. And when you do that, we have a net gain of $400 million. So the state still got to put up $290 million just to expand Medicaid. It's not a 95.5.
That's not 95. That's more 40 or 50.
Paul, I will tell you, when they told me that Medicaid was a great idea and I looked at it, it was 95.5. That's what the feds told us. And when we dug into it, Bob and I have dug into it, and we decided to do a white paper, and you've got a copy of it.
I got a copy of this.
And it simply says that the problem's going to be that it's not a 95-5 split. That's what it's supposed to be, but it doesn't work that way. You got to have 1115 waiver. There's so much red tape you got to go through.
Wait a minute. Are other states experiencing the same thing? In other words, when they do it and they get down to the bottom line, it is also not done. Because we were told it was 98 cents on the dollar, and then at worst, it could go down to 95 cents on a dollar. That was one of the many things that were thrown out there. Do other states, are they experiencing the same thing? In other words, is it costing them more than they thought?
Well, there's been different options out there, too, that we need to think about. Some states went with this 1115 waiver, and the funds were taken. Of course, that had to go through the legislature, and it had to be approved, and it had to be approved by the federal government. And then those funds were used to buy, if you will, health plans that might have been on the exchanges. The issue is if there's a copay related to any of those, you're still not everybody in those states paid those copays, and a lot of times the states were chasing the money. So the great thing about this paper is we kind of lay out all the options. You can go waivers, you can go this way. What are the things you need to look out for? So states have experienced different things.
We got 2.9 million people last census. Give me some numbers, guys. How many people do we have in the state on private insurance or workplace insurance?
Well, let's start. Let's go another route. Let's say that on Medicaid we've got, and Medicaid and CHIPS program, we got about 747 million. Bob just gave me the number, and I was right on target for it.
747, 477. How about that?
477, and 1.2 million people in Mississippi receive health care coverage through their employer, so you could call that private insurance. And then you have probably another 150,000 people that buy private insurance or short-term coverage, and et cetera. So about 1,350,000 people have private insurance.
My question is, where are we taking these extra 250 to 300,000 people? Are they unemployed now? Are they coming off of a different program? Or are they coming off of private insurance or workplace insurance?
Well, when you look at the number that Kaiser Family Foundation, CMS, gives us, those people will come out of the unemployed, one, and they're the people that fall through the cracks that have no insurance at all right now, not have a prospect of having insurance. They're the poorest of the poor, and they all make less than $12,000 a year.
It is, and I was noticing most people are eligible for subsidies when they earn 400% or less of the federal poverty level.
That's correct.
That's right.
Will is the expansion on? I think the expansion was above 138%.
Well, what happens is the expansion can you actually increase the tax credit under the existing ACA, and the expansion basically is to cover people at 138% of property level down.
Next, put your brilliant minds together. What is the solution? What do you want to see from your office? What do you think would be the best, not only for the people, but for the tax? Later on, Mike Chaney's in the house along with Bob Williams, and we're talking about so many different things. Number one is the initiative itself, bad news, a bad idea, because it would set in the Constitution a mandate that they have to fund this, regardless of what the money is. What would happen to the – here's another thought. If it's specified, would it be specified in the Constitution as an amount, or would the amount change?
I can't answer that, Paul. We do have a copy of the proposed amendment to the Constitution as written.
Are they collecting signatures now?
They are starting to get and ready to collect signatures. And I think we do have a copy. We got one yesterday, I believe, of what was proposed by the Attorney General. She rewrote the article. Now, mind you, to the public out there, we're talking about Medicaid expansion,
right,
in the attempt to put Medicaid as expansion as a constitutional amendment, and that effort's being funded supposedly by the Mississippi Hospital Association. There are many of us that think maybe
which gets their monies from hospitals,
right,
so hospitals are funding this,
right,
through where they get their money is through.
They get their money from patients that go there to see them, and most of that money, about 70% in the state of Mississippi, comes from Medicare and Medicaid, which hospitals say they can't make it on. They got to have private insurance. So if you expand Medicaid and if you do it wrong, the public needs to know their private insurance premiums are going to go up, because the hospitals would demand more money out of private insurance to cover the loss leader of covering more Medicaid.
Here's what I do not understand about this one, Bob, because it would seem that this is a government service that has a possibility of changing from administration to administration, and you've locked it into the Constitution. How is this possible? I mean, how would even the courts allow this to happen?
Well,
why would the Hospital Association do this? Well,
that's what I was talking about earlier. Is let's remember, you've got to get all these signatures. You've got to get 2/3 of both houses for this to even go be voted on. Let's say it's voted in. You can always have these challenges to the Constitution come up, and that's why when the commissioner,
just get closer to the mic, sir.
That's why when the commissioner was saying earlier, the better way is to do this through legislation.
The governor's coming on, and certainly we'll ask him about this one. But is there any indication from the House and Senate that certainly we don't need to call a special session? I mean, it's going to take a while to do this, but.
Well, I haven't personally talked to the Speaker of the House. I have read the news reports where he said he is very much opposed to expanding Medicaid under any shape, form, or fashion. The governor said the same thing as late as the last week. The lieutenant governor is keeping his options open, which is what he's supposed to do, and it'll be an issue that'll have to be addressed.
I'm reminded of two states, I think it was Arkansas and Indiana, that had to come back and say, man, we got problems with this thing the way we did it. What happens if we do it and we find out we got problems with it?
Well,
and what did they do, Bob?
Well, Arkansas actually did what I was talking about earlier. There was an 1115 waiver. They had health plans before they went to true Medicaid expansion. And what they found is what I was talking about earlier. If there was a copay involved in that where people had to pay it, we're talking about people, let's talk about the state of Mississippi where, we're talking 45,000 is average income, and you've got people that can't even, they're having problems economically, and then you're going to have them paying a copay, and then the state's chasing it. And that's what these other states saw.
In Indiana, Paul, they found that people did not have the money to buy into the program. They wanted to have skin in the game, and they just didn't have money to go in. And that study's out on the internet if people want to look it up.
But, I mean, they're pointed to as failures sometimes as far as the expansion process.
Well, the expansion process has failed in Arkansas, not as bad in Arkansas as it has in Indiana, simply because people did not have money to pay the $20 a month that they had to have for skin in the game. When you're making $12,000 a year and you're living on the edge, $20 a month is a lot of money. That's like having $2,000.
Yeah. But a lot of times, too, these folks are going to the hospital when in the emergency room, and that's causing the hospital some problems.
It
as far
does
as
cause
service.
But the hospitals all wanted this, and now they've got themselves into a quandrum. This can be fixed if you expanded Medicaid and you did it the right way, stayed within your lane of traffic that you're supposed to be in.
Because I want to talk more about it on the other side of the hour on something else that leads to that. But what's your suggestion?
My suggestion
both of you guys, what do you think is a great plan that would placate the House and Senate, the legislative process, the taxpayers, and those who need the service?
You've got to expand it within the existing framework. If you want Medicaid to expand, you need to stay within the existing framework. The legislature needs to be the one that controls the payout and the funding for the Medicaid expansion. We have looked at the Department of issuing an insurance policy. The problem with that is that people that are on Medicaid are used to paying zero. With an insurance policy, you've got to have some type of deductible to make it work, unless you design a policy.
But if you're stepping up as far as from the 138% and you're going up a little bit higher,
then they can pay.
Then they can pay a little bit.
Can pay. We're talking about the poorest of the poor.
Yeah,
138% of property level, which is about $14,000 for one person, on down to zero.
To me, we've talked about this so much ad nauseum, but it seems the whole system is broken in the first place, because one of the things about this was to make us a better, healthier place. Apparently, it ain't working. We've dumped a lot of money into this. I ain't seeing much money we've done since you've been commissioner of insurance. I mean, we've put over the last few decades literally billions upon billions of dollars in trying to solve poverty and solve health care in the state.
Well, let me just say, as Commissioner of Insurance, I have nothing to do with
I know that, but I'm
Medicaid.
just saying that there's a lot of money that's gone into this. So the model is not working. We always talk about a health care card or some type of savings account or something that lets the people, the end users, be more responsible. But people think, well, that's a good idea, and that's the last you hear about it.
Well, I agree with that. Well, in my 14 years,
that will be the last you hear about it.
In the 14 years I've been commissioner, the state of Mississippi has put out close to $20 billion. $20
billion.
$20 billion.
That's on health care?
On health care. Well, that's a matching funds they have to put up for Medicare. On health care, I don't even know what the number is.
I want to go back to something else you said. You said we cannot lock it in. You cannot, with any certainty, Bob or you both, tell the people of this state or any of the legislatures who may ask you that if we could lock it in at 95 cents or 98 cents. There's no way to do that.
If the feds would give you a guarantee that they're going to pay you,
they don't give you a guarantee.
They do not give you a guarantee,
even with a timeline.
They give you 24 months beginning in February of this year under the Rescue Act. So you've got 2 years of guarantee at 95 and 5 supposedly, but that's really not the number. It's going to be more like 90% and 10%, the existing program. And you got to remember that if you expand Medicaid, you're going to take people off the existing program and put them on the new program. You may save some monies there. That's debatable as to whether or not the feds would let you do that. So you've got to have some certainty from the federal government before you ever step out there and expand Medicaid.
So the legislature is thinking about doing this in the next session, and they called you and they say exactly how much is it going to cost? How many people do we have to expand? In other words, you said there's, by the time you group these demos together, probably 250, 300,000. Do you have to put all of those in there? Is that mandated by the federal government?
It's not mandated that I know of, but you're going to have to cover them. They're not going to let you do half the people and not cover the rest of them.
Yeah.
The Fed's not